morning. My name is Rachel Cunningham. I'm with Texas Children's Hospital, and I'm really honored to be here moderating this session today. If you can see me, I'm so sure I didn't wear heels and barely reach over this computer. Okay, I'm standing on my tiptoes. So, this session is focused on building partnerships to address the needs of disparate populations. So with the successes in public health, there is no need to reinvent the wheel, but we should always look for new and fresh ideas on how to package it. And so this session is going to include a discussion on why non-traditional partners and immunization stakeholders are an important part in building long-standing community partners. We're going to talk about exploring the process of targeting new partners to increase community involvement and finding funding for nonprofit projects and in-kind partnerships for collaborations. So building partnerships and working together, it is so essential to reaching our goal and reaching vulnerable populations. And the best results are often produced from effective collaborations. So we're going to talk about engaging stakeholders and partners and how important it is with our work with disparate populations. And this session will hopefully empower you to go out and engage partners in your own community while giving you ideas and resources on how to effectively identify, engage, and maintain these partnerships. So I'm really excited to introduce our two speakers today, LaTasha Hinckson Callis and Terri Andrews. Ms. Callis is going to be speaking first. Kind of weird to call you Ms. Callis, but we're going to go there. LaTasha is a community involvement coordinator with the Immunization Bureau of the Houston Department of Health and Human Services, has been with the organization for 2.5 years. Before joining the Houston Department of Health and Human Services, she worked in Chicago and Houston at 2 different nonprofits involving conducting community outreach and education by increasing awareness through the Chicagoland and Houston area communities. She graduated from UT Austin with a bachelor's degree in Spanish and is currently attending the University of Texas at Tyler to gain her master's in healthcare administration. She's passionate about reaching underserved communities and increasing efforts to spread vaccine-preventable disease awareness while halting disease. She enjoys life outside of work with her fully immunized husband. So on a side note, LaTasha really does exemplify these practices in her daily work and obviously her personal life. And lucky for me, I'm often someone with whom she engages to collaborate. And so, in fact, we call each other our work cousins. But I'll let LaTasha make her way up here.
Good morning, everyone. Thank you, Rachel, and she is right. She is my work cousin. We work very closely together because we're both based in Houston. I'm very happy to be here to speak with everyone today. For those of you who may not know, I actually started in Houston with the Immunization Partnership. So 2 years ago and 4 years ago, I was the one actually planning the summit. So I'm very happy to be speaking at one now and just see how long the partnership has come pretty much from where we started about 4 years ago. So I'll just jump into the presentation by first disclosing that I have no conflicts of interest. And then I wanted to give just a little bit of a background on the health department where I am in Houston. The vision for the health department is self-sufficient families and individuals to be in safe and healthy communities. And the mission is to work in partnership with the community to promote and protect the health and social well-being of Houstonians and the environment in which they live. So more specifically, I'm in the Immunization Bureau. Most of you are very familiar with these 5 projects, so I won't go into great detail about it, but just to let you know what it is that we do at the health department. We have, obviously, the Vaccines for Children's program. Those individuals help to ensure that our providers that participate in the program are following policies and protocols. And of course, most importantly, they work to ensure that the integrity of the vaccine obviously is maintained through proper storage and handling. We also have a provider education and training team. It consists of 5 individuals that go out into the community and conduct presentations. The assessment and compliance team, they're a very efficient team of individuals that are based pretty much in the field, and their main goal is to ensure that the kiddos in the child care facilities are up to date on their immunizations. perinatal hepatitis B. It's a team of nurses that do case management for pregnant moms that have tested positive for Hep B. And their main goal is to case manage, follow those moms through pregnancy, and ensure that the kids are protected from hepatitis B. And last but not least, of course, MTRAC. And that is made up of senior data entry operators that ensure that all of our records are up to date anytime we have clinics and things of that nature. And then it also is made up of an educator that goes out and provides education to providers. So what I'm going to use the bulk of my time today to talk about is a project that we implemented, and it's a little bit of a tongue twister. I'm not sure why we called it this, but it's the Mobile Unit Mobilization Project. So it was created by the health department, and the goal was to partner with mobile units in Houston to increase immunization rates among high-risk populations. And the way in which we would do that is by identifying 2 locations that we would target, and we would conduct reoccurring vaccine clinics in those high-risk populations. And we would do that by the use of GIS mapping in order to determine where we should be. And then, of course, monitor and track the success of the program to find out if it's something that we should continue moving forward or if we need to tweak and make some changes. So the first thing, in order to effectively promote the immunization message and build partnerships, I believe first you have to determine what the issue is, of course. Ideally, projects should be a proactive means to prevent an issue, but in reality, we know that's not the case. Most projects are created in response to an issue. So for example, we have an outbreak of measles, and then we all gather together and try and come up with an idea of how to address this issue. Or we find out now, okay, we have low HPV coverage rates. What can we do to try and increase those rates? Ideally, my hope is that we were able to come up with these projects where we would never see these things happen. But obviously, it's the nature of the beast, and that's the society we live in. So we're more of a reactionary society and not a proactive one. So at the health department, we decided, what is our issue? And it's probably a very similar issue that other people have seen, which is underserved communities. Pretty much these populations, we all know they experience a larger gap in access than other groups. And that is evidenced through low immunization coverage rates among other health disparities that we see. The other issue is overcoming barriers. We know that those same populations have many barriers that they have to overcome, like transportation, time off of work, competing priorities. So if it's a family that needs to choose between feeding their family and getting that child vaccinated, I'm pretty sure they're almost always going to choose feeding their kids, and who wouldn't? So we need to try and address how we can help them to overcome those barriers. So how do we do it? Number one, we can identify partners that have access. And what I mean by that is identifying people who have access to the groups that we want to target. Number two, we can schedule easily accessible vaccine clinics. Specifically for our project, our goal was to increase immunization rates through vaccine clinics. But if we were trying to target a population that's right outside our door, but we set up a clinic that's 10 miles away, that's probably not the best way to make it accessible for them, especially if they have barriers with transportation. And last but not least, I think education and awareness is something that we can use to overcome barriers, mainly because parents, we need them to buy in, right? So we can have the biggest, shiniest venue, we can have all the best partners, and we could even have media attention. But if we don't actually have the parents there to show up and bring their kids to the clinics, what good is all of that? So we want to make sure that we're best utilizing our resources, and the way that we can do that is to first educate the parents and provide awareness. So this map is what we used at the health department to determine the locations that we would target. So what we decided was we would pull data on zip codes in Houston-Harris County that had high birth rates and low immunization coverage rates. And when I refer to low immunization coverage rates, the easiest thing that we could do was pull rates for low fourth DTaP, because we know that kids that are missing that fourth DTaP generally are missing other shots as well. So we then analyzed it to find out if there were any zip codes that overlapped. So they had high risk high birth rates and low immunization coverage rates. And for the ones that did, we identified those as high risk for what it is that we were doing. So it's not as difficult to see as on my screen. So the yellow zip codes are the ones that had both high birth rates and low coverage rates. And there were 26 of those zip codes that we identified as high risk. So now that we've determined the issue, the next thing we needed to do was identify and recruit partners. It's completely and utterly important to get the right partners at the table, right? So the way in which we did that was to find out who can best help us reach our goal. Our goal ultimately, of course, was to increase immunization rates. So what is it that we needed to do? The immunizers. We needed to partner with them. Specifically, we wanted to partner with the mobile units. And I know that in immunizations, we're always promoting the medical home, which we do at the health department. But for the purposes of this project, what we wanted to do, again, was easy access. So if the parent is already having difficulty getting to their own medical provider, then us doing this project was not going to help make it any better, you know? So what we decided to do was partner with the mobile units and bring the vaccines to them. And I'll talk a little bit later about the locations that we chose. 2 mobile units in particular in Houston, they're absolutely fantastic. Christus Health and then also Harris Health System. The benefit of working with Harris Health System also is that they actually have clinics, so they could then refer them to their medical clinics within the Harris County area. So the third thing we needed to do, we've determined the issue, we identified the partners, now what is the plan? So we needed to ensure that we had the key players present. And when I talk about key players, I'm not only referring to the external partners, but internally. So because we were doing so much mapping and data analysis, we needed to make sure that internally at the health department, we had the right people at the table. And I have to just give a brief shout out, although he may not ever hear this, but Sean Dade is a management analyst with the health department, and he worked tirelessly to get all of this data and plot it for us, and he did an absolutely fantastic job. So it's important to ensure that you have all of the right partners at the table, and then set goals and create a timeline and evaluation process. So in implementing the plan, think about what you hope to accomplish and create your goals accordingly. Our overarching goal was to increase immunization rates, but we wanted to also make an attainable goal, because it's easy to say, oh, we want to increase immunization rates, but we don't want to have the project go on for 8 months. We turn around and we look back and we're like, oh, we can't really tell if we made a difference. So the low-hanging fruit and attainable goal we made was we simply wanted to schedule these vaccine clinics in high-risk zip codes and have them reoccurring, and we wanted at least 20 people to be vaccinated each time. That's an attainable goal, because ultimately, if we can get the consistency, that would lead to an increase in immunization rates. And then lastly, just don't lose sight of your initial intent. If the intent of the project or program is to help bring awareness to a community, don't lose sight of that. Keep the focus, and that'll help energize you to see the project through, no matter what things and roadblocks might show themselves. So for the mobile unit mobilization project, what we did was invite contacts to meet and discuss the how. They all came to the table, and we needed to identify where they had been in order to decide and tell them where they need to be. So this next map was a lot of work. We had to coordinate with those 2 mobile units to get their calendars for the entire year of 2013. Which they were able to provide to us. It might be a little difficult to see, but in the yellow is Harris Health and green is Christus. The red areas are the high-risk zip codes, and as you see, the majority of the places that they had been in 2013 did not include a high-risk zip code, and that's what we thought, and that was a good thing because we needed to redirect them to those populations. So we broke down the data a little bit further and saw that, number one, the southwest quadrant of the city of Houston actually had the second highest number of high-risk zip codes, but it actually had the lowest representation for the mobile units for 2013. So Christus had only been to one of those zip codes once, and Harris Health 6 times, whereas Northwest Houston, which is not high risk at all, had 41 visits from them. So we knew that we needed to work with them to redirect the efforts. So we had the plan, we had the partner, we have the issue. Now we need to monitor and evaluate. So what we saw, this is actually began March of this year, and obviously I only have data until October last month, but what we saw is a pretty good turnout. We wanted to target at least 20 clients a month, and we pretty much did that. Some sites lagged off a little bit, but I'm wondering about August and September. Does anyone know why? Of course. We always try every year to say immunizations are year-round. Don't wait till back to school, and obviously they wait till back to school. This next slide just goes over the clinics that were conducted monthly, and it compares the clients to the doses administered. So the good thing about this, it shows that it was needed. So if we look at the lighter line of doses administered, it shows that for each client, each of those patients were receiving at least 2 to 3 vaccines per visit. So this is just a deeper breakdown of the numbers, and you can see specifically based on the vaccine and antigen how many doses were administered. And it was actually a total of 970 doses of vaccines that were administered to high-risk populations in an 8-month period, which I think is absolutely fantastic. So the last thing that we did was we broke down the clients that had visited during those months, and we wanted to replot it on this map and find out if we were doing a good job. So our main goal was to target Southwest Houston. Southwest Houston, obviously, we were doing a very good job, and it goes to show that the location of the clinic brought in clients from other zip codes, and we actually partnered with WIC to hold those vaccine clinics because they already have the population that we're targeting. And if a parent is already taking off work to go get her WIC clients, then having vaccines available to her at that time, that's just killing 2 birds with 1 stone. So the takeaways is for this presentation, immunization stakeholders and non-traditional partners are key to a successful project. And identifying partners that add value is important. And know that these partners are a benefit and don't be afraid to tell them. You know, if you have someone that might be hesitant, don't be afraid to tell them, well, this is how this is going to benefit you. It benefits me in this way, yes, but this is also how you'll benefit from it. And when you make that clear to them, they're more likely to participate. And then lastly, don't reinvent the wheel, just rotate those tires, okay? So even though we've worked with these partners before in the past, just try and find a creative way to work with them again. And I know it's time for me to close, but I just wanted to show everybody another partnership that we have. We are just starting it, and we just have the materials created, so I can't really give you much more information about it. But our director at the health department really wants to focus on making Houston a healthy city. And so what we decided to do was create a healthy hotel project. So we created door hangers and table tents, and our goal is to put this in hotel rooms so that people that visit will be aware of the importance of immunizations. And we have about 10 hotels that have signed up. We know that it's going to be very difficult to get in with the big chain hotels because they have all sorts of levels that they have to go through for approval. But we focused on independently owned hotels for this project. So hopefully I can come back in 2 years and report success. And last slide is just thank you to Christus, thank you to Harris Health, and then also the health department. Thank you.
Oh, that was great. Thank you, LaTasha. Let's see. Okay, sorry. Well, our next speaker is Miss Terri Andrews, and I'm really excited to hear this. I got a sneak peek at these slides, and so just reading through them, I was just really excited to hear about what Tarrant County is doing. So Miss Andrews is the chairman of Immunization Collaboration of Tarrant County, has been there since 2006. After 20 years of volunteer service with her 3 daughters' activities and multiple community health education efforts in the Fort Worth area. She's Grants Committee Chairman for Texas Medical Association Foundation Board of Directors and holds multiple positions with Tarrant County Medical Society Alliance and Foundation and Texas Medical Association Alliance. And over the last 25 years, she's worked kind of everywhere: AIDS education, organ donation education, many children's health projects, and has served in many management positions. She grew up in New Jersey. Her husband, Charlie, they've been married 41 years. They met at Washington College in Maryland, and she has her BGS at TCU Fort Worth. And just a reminder, I forgot to say it before we started the last session, but this is all about social media, this summit. And so while we do want you to silence your cell phones, we encourage you to interact by on social media during the presentations with the hashtag Texas TXIZ14. I'm not a twit on Twitter, and so I don't, but feel free to hashtag away. Well, come on, Terri.
Twit away. Okay. Hi, everybody. This is my first time doing this kind of a program, so please bear with me. As Rachel said, that I am a volunteer. So figure out my slides. That worked. I do not have any relevant disclosure, any conflicts of interest. Like I said, I'm a volunteer, so there are no conflicts. I'm here today to talk about the immunization collaboration of Tarrant County and all of our partnerships. A little bit of history. We started in 1991, the measles outbreak in Texas. A group of people came together in Fort Worth and wanted to vaccinate a large number of people. What they needed was a vaccine supply, they needed volunteers, and they needed some funding. And these are the groups that came together. Over the next 4 years, they accomplished a lot. They vaccinated thousands of children. The immunization outreach team for Tarrant County Public Health was established and funded within the Public Health Department. They established yearly vaccine events that were at the zoo and various malls and health fairs across the county. And most importantly, Immunization Collaboration received its independent 501c3 status. And that is so important moving forward and getting all of the other partners together. The second most important thing was developing a mission statement, which you have to do to get your 501c3. Our mission statement is to provide a collaboration of agencies and organizations, public and private, committed to providing the systematic eradication of vaccine-preventable disease in Tarrant County. It's important to note the public and private entities that work together for this common mission. Now, we have traditional and non-traditional partnerships within the collaboration. We have vaccine supply, volunteer workforce, and funding, and I'm going to go through each one of those. Our vaccine supply is traditional. It's Tarrant County Public Health with the vaccine, the safety net, vaccine for children. They have been the consistent provider for 24 years, which certainly helps in our longevity. The VFC program became active in 1995 and covers children 0 to 18 years old. The health department also has some adult safety net vaccines, and our health department also purchases a limited amount of private pay vaccines. So at our clinics, we can provide all across the board vaccines. Our volunteer partnerships are really divided into 2 types. We have leadership partnerships that actually run the collaboration, and then we have event and education project volunteers. The board of directors is the leadership partners, and they come from all over our county. We have representatives. The way we're set up is each organization has 2 voting places on the board. So we operate differently than most nonprofits. Tarrant County Public Health Immunization Outreach is obviously part of our board and leadership. The Tarrant County Public Health Immunization or Community Education departments, and I'll go through some of those in a little bit. The State Department of Health Services is part of our collaboration. Cook Children's System, the system and physician network have been consistent partners. Our county health system, JPS. We have all the pharmaceutical companies in the room. as part of our collaboration. Rotary has been part of our collaboration from the beginning, and they provide volunteers and funding sources. The different part of this is everyone is committed to that mission. So we all have our common goals. All of those partners are already involved in vaccine in some way. So it's easy for them to fit our collaboration into their regular workdays. Many of them have incorporated immunization collaboration into their job descriptions. The immunization outreach supervisor, her job description is to participate with the collaboration and all of our other partners. We partner with the community health fair organizations. They are part of our collaboration. And of course, the civic organizations. There's so many of them in every city and county that are involved in children's services. The leadership partners, we have over 40 organizations, public and private, on the board of directors. We do have an executive committee. We elect officers each year, but ICTC itself has no employees. And everybody goes, how do they do that? It's just been ongoing, and everybody works towards the goal. Our non-traditional leadership partners you need to promote your mission, to bring them in and explain to folks how, by participating in our collaboration, their organization also benefits. And how do we go ahead and connect to these organizations? We give them ownership. We give them votes on our board. So if you come, you have a say in what projects we develop, and any good results we have, good or negative results, can go back to your organization. So both sides win. Our key issue is leaving your organization issue at the door. And what we look for is anyone interested in a healthier community. So that's a pretty broad spectrum. Who are our non-traditional partners that participate actively in our collaboration? Catholic Charities has representation. Our Head Start and Early Head Start programs, Child Care Associates is the organization in Tarrant County, and their nurse leaders come to our collaboration. Other health coordinators that have vested interest in vaccines, funding organizations have a vote on the board if they choose to, hospital systems with their health programs, and we have a number of just individual community volunteers that participate in our board. We have the Medicaid health plans. There are 4 plans in Tarrant County, and all 4 are in the room. Ronald McDonald House Charities, which many of you will probably recognize, but think all they support is the houses. They have an Immunize for Healthy Lives program that we partner with. They do tray liners in the 4 North Texas County region. They do 1 million tray liners in July and August that promote vaccines and where to get back to school vaccines. It's a great partnership, but they also have direct funding for projects too. Senior Citizen Services, it's not someplace you would normally think of, but they'd love to pack up goodie bags. They love to be part of us when we do our celebration brunch. We invite them to come, and they just love you get to say thank you to them. But they're really good workers, and many of them can work in at the clinics, and they already have volunteers. If you just make contact at a senior citizen center, and you can find good volunteers. We have the head nurses for all the public schools in Tarrant County. We attend a monthly meeting with them and have give and take on information. They meet with the Medical Society for what's going on with health in the county, but immunization collaboration is at that table, so we can share back and forth with the schools. And the Tarrant County Medical Society Alliance, there are alliances in every county that has a medical society. There is a Medical Society Alliance, and they want to do community projects, so touch base with them. The Texas Medical Association Foundation is our source for Be Wise Immunize. That's one of their major projects, and they send their projects down to the county level for the alliances. A lot of support. The that we get from them. Tarrant County Public Health has leadership, and the other departments I mentioned earlier. We work with the WIC clinics are represented, vaccine distribution, the vaccine clinics in Tarrant County, and even epidemiology. We get the Tarrant County epidemiologist comes to all of our meetings and gives us an update on what's going on. He's been pretty busy lately, but he actually made our October meeting. It was great. United Way, the 211 is across the state, and they have vaccine information. If you call 211 anywhere in the state, they can tell you where the closest vaccine clinic is. Pull your local representative into your group, and you've got another collaboration. Graduate students, we happen to have the UNT Health Science Center in Fort Worth, which is medical students and public health students, and pharmacy and all kinds of things. So look towards the graduate schools. I have a complete list is on our website. If you go to About ICTC, you can see all the different organizations that are part of our collaboration. Then we have our event volunteers. And these are the folks that help do our education projects and work our August back-to-school events, vaccine events. We do 23 days of vaccine events and vaccinate between 4,500 and 5,000 kids in the month of August through our immunization outreach. Thank you. We have state and national organizations. The Immunization Partnership is part of our collaboration, just grab hands and work together. Immunization Action Coalition is a national group that you can get lots of information from. Our non-traditional partners, again, civic organization, churches, college students, all the schools, junior leagues. These are just lists of different places. One thing, look to your emergency preparedness group, because every city in Texas, I think, has emergency preparedness, and they have lists of volunteers, and they may want to come out and help you with your things. Partners come and go over time. Always keep your eye out for potential partners. And how do we nurture our partners? We make it easy. They can volunteer on an internet site. We have a clear description of what our clerical volunteers do and do not do. The health department handles the vaccine, but our volunteers do all the clerical side. Unity matters. We have yellow T-shirt, Be Wise Immunized T-shirts that every volunteer gets, and staff and the volunteers all wear the yellow T-shirts. We use just-in-time training, meaning one shift comes in and they get oriented in their specific job, helping families fill out paperwork or copying shot records. The next shift comes in 15, 20 minutes early, and they train each other and then trade off. If you feed them, they will come. We all know that. We feed our volunteers very well, and we thank them very much. And we request feedback, and then we do the October brunch, where we invite all our funders and things. This is just from August. We had 120 volunteers with 1,268 hours put in just in August. And this gives you a view of what our T-shirts look like in the rooms. This one, the bottom left is from Como Senior Citizen Center. They're packing up bags at the senior center. They all put on their T-shirts because it's Be Wise Day, and they love it. Funding partners. I'm going to have to go a little bit faster. 501c3 status opens doors, and if you have a partner with 501c3 status, their doors open too. You don't need government funding to succeed with a collaboration. We have no government or United Way funding. That way you have control of your money, and you're not inundated with the reports. Long-term partners, Cook Children's, Junior League has come and go, Rotary. Over the last 10 years, the Cook Children's, the Alliance, and TMA Foundation have been our major funding partners. But we branch out. The energy companies will give you $500,000. Banks, same thing. And then there's some civic groups. First Grandmothers Club is in Tarrant County, and it's all grandmothers, and they give us $2,000 to underwrite the admin fee in August for the folks that don't have the $15. So something, partners like that, just open your doors. Where do you find these? We're moving into social media. This is new this year, some of the social media suggestions for getting money. I do apply to standing foundations, and again, you have to have the 501c3, but there are a lot of private foundations, and just start with little asks, and you can ask for more money as you have projects that need funding. What I do is I save every invitation that comes. This time of year, it's fundraising time. Every invitation, the back of our booklet has sponsors on it. If you're in the Houston area, look up those sponsors and see how to ask for $500. They're already invested in vaccines. Every single invitation that comes through, every thank you to our donors in the newspaper or magazines, look at them and see if you know somebody, or just get online and ask them for a little bit. What's the worst they can do is say no. Doing good work's not enough. We do have a strategic plan, and we use results-based accountability, which just means we have a lot of measures in place. It's a strategic plan from 2013 to 2016, so I will have measures by January. We can always say how many kids we've vaccinated and how many doses, but you want more information, how many health fairs, how many touches that we've had. Diversity of funding, the in-kind donations, you can always look for those. We get water from our food bank. The public health provides a discounted admin fee in August. It's normally $25 in Tarrant County, but we get $15 for our August events because we double the number of kids vaccinated by Tarrant County Public Health. All their clinics do about 5,000 kids. We do another 5,000. We get collateral support and, of course, the Be Wise things. Our locations are mostly donated, churches, health fairs. We get extreme booth support. We pay $50 and get a booth the size of 10 booths. We do pay a little bit of rent to La Grande Plaza Mall just to guarantee a spot for 11 days that we're in there. And that way we have electricity and air conditioning, and if the bathrooms aren't working, we can call them. We have donated meeting space, and our general report for 2014 is 60 organizations are part of the collaboration. Over 108,000 children have received vaccines at our collaboration events since 1991. For 2014, we served 7,400 children with 20,000 doses of vaccine. 507 of those were sponsored by donations where the health department got their $15. We distribute the education materials year-round, and we continue to provide the other education venues in Tarrant County. And we also participate in advocacy for the registries. And I think my call to action was to find one new partner, find one new leadership partner, one new volunteer partner, and one new funding source. There's a whole lot you can get done. Thank you.